Welcome back to our channel Medicine Moms. Hope everyone are doing fine. Did everyone go and watch the previous video which Vidya has uploaded regarding the cardiovascular system? If not, just go back and take a look on it because it is very important in aspect of ICD as well as CPT. When it comes for CPT also, it is very important cardiology system. Okay, so just go through that and try to solve the questions which we are giving. Okay, because if you want to clear your examination, the thing is you need to keep on working on it. You should solve how much questions you solve, that much you'll be confident to apply the guideline. So try to concentrate on solving the papers. Okay, so we are providing that in our student group also. So if you want, you can join in our student group as well as there is a Telegram group in our thing. So you can join in that also. So those who have not referred for that, just go back and refer for that particular system. Okay, so today here I am with respiratory system. In this basically we'll be dealing with some common anatomy and physiology and the ICD guidelines which is from respiratory system. Okay, so directly we'll go to the anatomy. In this, when we think about the respiratory system, the main thing is you should know it is divided into two, the upper respiratory system and lower respiratory system. Commonly you will be hearing like upper respiratory tract infection, lower respiratory tract infection, isn't it? So you should know what all things comes under upper respiratory tract and what comes under lower respiratory. So in upper respiratory there are three things. It is nose, pharynx and the larynx. So when we think about the nose, air enters first through our nose, isn't it? So the air passes through the nose and then it goes to the pharynx, then larynx, and then comes the lower respiratory tract. In the nose, there are small hair follicles, isn't it? So what does this do? This hair, what is the purpose of this particular hair? When there is a foreign body entering into our nose, we will sneeze. That is the reflex which is created. Okay, so the sneezing is a particular reflex when a foreign body or a dust particle enters into our nose. So hair helps to, the small hair particles helps to do this sneezing reflex. So that is the importance of hair follicles in the nose. And nose is divided with a nasal septum. Commonly you people must have heard regarding DNS, deviated nasal septum. That is because of when the nasal septum is getting slightly deviated, we will get like deviated nasal septum. Because of that, some people will get the snoring reflexes and then sinusitis, all this kind of disease conditions people will be getting. Okay, so this is basically for nose. And one more thing is regarding the olfactory nerve. When nose means it is olfactory. Olfactory is the first nerve and it is the sensory nerve. Why it is sensory? Because it recognize the smell. The impulses will be carried to the brain through olfactory nerve, so that we'll be able to identify the smell. Okay, so this is the main function of nose. Then comes the pharynx. When we talk about the pharynx, this is the part of throat behind the mouth and nasal cavity. It is situated behind the mouth and the nasal cavity. That means just beside the nose the pharynx comes. Okay, and it is a part of digestive tract that gets food from the mouth, and branching of pharynx is esophagus, and through esophagus food will go into the stomach. Okay, understood. That means our food, whatever we are taking, that will pass and then it will be transmitted to esophagus, and then through esophagus that particular food will be going to the stomach. This is the main function of pharynx. And in pharynx there are mainly three divisions: oropharynx, nasopharynx and then laryngopharynx. Naso means nose, oro means mouth, then laryngopharynx means related to larynx. Because when I talk about larynx, you will come to know what is the importance of laryngopharynx. Okay, so nasopharynx, oropharynx, and then comes the laryngopharynx. Okay, then the next thing is larynx. When we talk about larynx, the main thing which should come to your mind is voice box. It is also known as voice box and it is located top to the neck. What does it do? It will help for breathing and producing the sound, and also it helps to protect the aspiration of food. What happens when the food is taken? It will be passing through the pharynx, isn't it? So laryngopharynx, I have told you. So there is a small bypass which is connected. So there is a chance of getting aspirated. Food may get aspirated. So this aspiration will be prevented with this larynx with the help of epiglottis. When we take the food the epiglottis will come and close that one so that we will be easily able to swallow the food without aspirating. Okay, so this is the function of larynx. So this is upper respiratory tract. Now comes the lower respiratory. In lower respiratory, there are mainly two things. There is the bronchial tree and the lungs. In bronchial tree, I have just drawn a symbolic thing here. It is like the bronchial tree starts like this and it becomes like branches, bronchi, bronchioles, and then comes the alveoli. Okay, so alveoli is the place where the gas exchange happens. Okay, so this is nothing but the bronchial tree. Then comes the lungs. Lungs is very important in aspect of interview point of view and all. It is very important, and even there are 10 mark questions for anatomy. In that one question will be the number of lobes of the lung, either for the right or the left. So you should be confident with the number of lobes in the lungs. So in this, it's divided into two. It's the right lung and the left lung. And this lungs are divided. In right lung, it is divided into three. That is superior lobe, middle lobe and the inferior lobe. Superior means the topmost portion, middle means in between, inferior means down. Okay, those who are not familiar with these terms, just go back to the human orientation video and just have a look on it. In that we have clearly explained all the directions, planes and everything regarding the human anatomy. Okay, so that you will get an idea for this. Okay, so superior, middle and inferior. These are the right lung lobes. And comes the left lung. It is superior and inferior. There are only two lobes in the left lung, so it is divided into superior lobe and the inferior lobe. Okay, and how does this get divided? It is divided with the help of fissures, and those fissures are called as oblique and horizontal fissure. When it is an oblique cut, it is oblique fissure. When it is an horizontal cut, it is a horizontal fissure. Okay, the nose is divided with the septum, isn't it? Likewise, the lungs is divided with fissures, and that fissures are like oblique fissures and horizontal fissures. Okay, these are the main things which we need to cover under respiratory system for the anatomy. This is just a brief. I know this is not in detail, but whatever we need for ICD and CPT, I have covered in this, and when we are providing the notes, we will be giving a detailed description for all these things. Okay, so now we'll deal with the ICD guidelines for respiratory system. In this, basically there are 4 guidelines. So in that, the first one is chronic obstructive pulmonary disease and asthma. So moving forward, I'll be telling like COPD. So you should know what is COPD, chronic obstructive pulmonary disease. This you will be getting as a 1 mark question for abbreviation. So make sure that you know regarding this one. COPD means it is a group of conditions like emphysema, chronic bronchitis and all. Okay, so chronic obstructive pulmonary disease. In this, the first guideline is like acute exacerbation of chronic obstructive bronchitis and asthma. 2 things you should know. When an acute exacerbation will occur and what is acute exacerbation or what is exacerbation. What is exacerbation? That means a patient is having or a person is having an established condition. Okay, established condition means known condition. The patient is already diagnosed, but currently the patient is not having any symptoms for that particular disease. But due to some or the other triggering factors, patient is getting that particular condition again. That particular scenario is known as exacerbation. Okay, so acute exacerbation means due to some triggering factors. For example, if the patient is having asthma and all and was on long-term treatment, currently the condition is settled. But sometimes when the weather changes or some dust particle enters, they may get this sudden asthmatic attack, isn't it? So this particular thing is known as acute exacerbation. Okay, so you should understand from the particular given scenario whether it is an acute exacerbation or not. They may not give directly like exacerbation. Sometimes they will give like some other scenarios. Patient was on treatment and patient was stable, currently got an attack. That means it is exacerbation. You should understand by reading the scenario itself. So in this case, whenever there is an acute exacerbation, is not equivalent to an infection superimposed on a chronic condition, though an exacerbation may be a triggering by infection. The only thing what you need to do is to choose this J44 series. You should identify whether it is an acute exacerbation or not. If it is acute exacerbation, go for J44. Okay. So, and also one more thing is like, it can occur due to some of the other infection. Patient was already settled with that particular condition due to some sudden infection. For example, like bronchitis and all, patient got affected with bronchitis. So that the COPD emerged again. That case also we can call it as acute exacerbation. Okay, so I hope you understood when to choose this J44 code. So the next one is acute respiratory failure. The second point is acute respiratory failure. In this, there are 2 points. The first one is like when to choose acute respiratory failure as a primary diagnosis, and the second one is like when to choose acute respiratory failure as a secondary diagnosis. When to choose this one as a primary diagnosis? When the reason for encounter itself is a respiratory failure. Okay, for example, the encounter is like something like choking. Maybe the baby was drowning in the water and suddenly the baby got a respiratory failure or respiratory arrest. Okay, in that case we can code it as a primary diagnosis. Okay, that means the reason for encounter, the person is coming itself with a respiratory failure. In that case, the management is given for acute respiratory failure, so that will be your primary diagnosis. Okay, so when we will code this as a secondary diagnosis, that means the patient is coming with something else and after the admission patient is developing a respiratory failure. For example, if the patient is coming with a poisoning, for example like any opioid overdosing or something, if the patient is coming, patient is getting treated for this overdosing, and gradually after 1 or 2 days the patient is going for respiratory failure. In this case, your primary diagnosis will be for the overdosing, like means the poisoning, and the secondary diagnosis will be for the respiratory failure. Okay, so these are the 2 scenarios when to choose a primary diagnosis as an acute respiratory failure and when to choose ARF as a secondary diagnosis. Okay, so these are the scenarios. Just the main thing is you should have the capability to analyze the scenario. The questions given you should read properly and understand for what reason the patient is coming. If the reason for encounter is for respiratory failure, directly go for it as a primary diagnosis. If not, something else is the encounter, choose the encounter as a primary and respiratory failure. If the patient is developing after admission, code it as secondary. Okay, so in the second point, there is one more point, which is sequencing of acute respiratory failure and another condition. Okay, in this, the thing is like, the patient is coming with both acute respiratory failure as well as an other emergency condition. Okay, like for example, like some myocardial infarction, CVA or something like that. Okay, so the patient is, the encounter is like for both the conditions, respiratory failure as well as another condition. In this case, how we will prioritize the code? We will first check whether this acute condition is related to respiratory system or not related to respiratory system. If it is related to respiratory system, we can code first that condition, acute condition, then the failure. Okay. If it is not related to respiratory system, for which condition the doctor is giving treatment focused. For example, if the patient is coming with MI and respiratory failure, and if the treatment is directed towards MI, in that case we will code MI as the primary diagnosis. Or else if it is not documented clearly, like what is the reason for encounter properly or for which condition the treatment is directed towards, in that case you need to query your physician. You need to ask him for which condition the treatment is directed or for what condition you are getting treated with the patient. Okay, so this one you need to make a clarity. Then only you need to assign the primary and secondary codes in this. Okay, so first you need to check whether it is related to respiratory system or not related to respiratory system. And the second thing is you need to check to which condition the treatment is directed, and if you are not sure about that, query the physician. Okay, so this is the third point. And the third guideline is influenza due to certain identified influenza virus. What is influenza? Influenza is nothing but a common cold. Okay, so in this there are many categories like influenza A, influenza B, null influenza, all these things. So to code this null influenza and all, we doesn't require a positive lab report. If the symptoms are supportive, the doctor can choose a novel influenza virus. Okay. So in this case, what you need to do, you need to check whether the doctor is mentioning as possible, probable, like suspected, all these keys. If it is mentioned like that, you need to double check or you need to query your physician to provide a detailed description. Okay. So in between I told I missed something, just ignore that. Okay. And in this influenza due to certain identified virus, when the lab report comes, you need to check whether it is influenza A or influenza B. Based on that thing only, you need to choose the code. The category code will fall from J09. Based on the lab report, we can identify which type of influenza is there. If it is A, code based on it, and if it is B, code, choose the code based on that identified influenza. And the next one is ventilator-associated pneumonia. This is also known as VAP. Commonly in medical language, we'll talk like patient is associated with VAP. In that case, you should know what is VAP. It is ventilator-associated pneumonia. Okay. So in this, there are two things. Documentation of VAP and VAP developed after admission. What is documentation of VAP? Documentation of VAP is nothing but if VAP is not documented in the patient's EMR, okay, we will never assign that particular code, even though the patient have it. Okay, the doctors, for example, I'll tell you, the patient came with bronchitis, okay, and due to the severity, patient was transferred to ventilator. What is ventilator-associated pneumonia? Due to ventilator, patient is shifted to ventilator, and due to that particular thing, the patient is getting associated pneumonia. Okay, so here in this situation, patient is coming with bronchitis. Due to the severity or due to the complexity of the condition, patient is transferred to ventilator. So, and the patient is developing pneumonia after transferring to the ventilator. In this case, if the doctor is not documenting in written form as ventilator-associated pneumonia, if it is not documented, you will not assign that particular code. It should be documented. Doctor should document as patient presented with bronchitis and the patient was developed VAP due to so and so condition, and this is the organism. Other than that, you can't code ventilator-associated pneumonia. For that, the category code will be like J95.851. If you go to the textbook, if you are with the books, if you just go through it, it will be like ventilator-associated pneumonia. Okay, so this is nothing but documentation of VAP. The main thing I want to tell is it's not related to ICD, it's related to the entire CPC. Documentation is must and should. If you are writing the exam, if you are going for a job, or whatever it is, make a documentation in written format. If not, then whatever you say, we can't consider that one. The doctor is coming and telling that patient is having VAP, that patient is having VAP. We can't consider, we can't document this unless and until the doctor document that one. So documentation is very, very important. So when you read the scenario, make sure that the requirements are met, then only you choose the code. Okay. And the next one is VAP developed after admission. For example, like the patient is coming with pneumonia. Okay, pneumonia, and due to some complexity, the same scenario what I have told, patient is transferred to ventilator. In this case, we will be coding it as a secondary code. For example, like patient is admitted with pneumonia due to Klebsiella pneumonia, develops superimposed MRSA, ventilator-associated pneumonia. In this case, what we'll do, superimposed MRSA they have specified. Okay, when I took the sepsis chapter, I have mentioned regarding the MRSA guidelines. If you're not sure about that, just go back to sepsis and just go for the guidelines of MRSA. Okay, so in this, if the patient is coming with pneumonia, your primary code will be like pneumonia related to Klebsiella. As the scenario says, Klebsiella, your code series will be like J15.0, and the secondary will be VAP, ventilator-associated pneumonia, J95.851, and the third one is superimposed with MRSA. So you need to document MRSA also. Your third code will be like B95.62. So this is the coding guideline for VAP. In respiratory system, the main things are like for chronic obstructive pulmonary disease with asthma. Then comes the acute respiratory failure. In acute respiratory failure, what all things are there? There are mainly 3 headings: when to put primary, when to choose secondary, and when it is associated with more than one acute condition. And the third one is like influenza, and the fourth one is VAB. In VAB there are 2 points: documentation and developed after admission. So this is nothing but respiratory system. So just go through this. If you have any doubts, just ask us, just comment in the comment box. If you have any queries, you can mail us at millicentmom08@gmail.com. If you wish to join to the student group, you can request a mail. We will make you to join, and the Telegram link is given in the community bar. Just you can join with that link, so that we will give the recent updates, and the notes and everything will be shared in both Telegram as well as the student group. Okay, so guys, keep on supporting us. So in the next class, Vidya will be coming with next chapter. So keep on watching and support us. Thank you.